Good evening, everyone. Myself, Pravallika, Department of OBG, and I'm a faculty of Prakara, is here today to have a small session regarding antenatal assessment and minor discomforts of pregnancy. During the antenatal period, the women needs to be assessed continuously to avoid any high-risk pregnancies and any tendencies of any complications. And at the same time, the women will be experiencing certain kinds of discomforts too. It can be because of hormonal influences even. Like there will be disturbances in the hormones comparing to the non-pregnant status. Due to that, certain minor discomforts the women will be experiencing. So how to correct them or how to manage them? All that we will be discussing in this particular session. And first of all, we shall see what do you mean by this antenatal care. Antenatal assessment comes under antenatal care. So this is the care which is given to the women during the pregnancy, that is antenatal period, from the time of conception is confirmed till the birth of the baby. Like till her labor starts, during this antenatal period, the care that the woman is receiving is considered as antenatal care. This antenatal care can be included as like assessment, advices. All these are a part of antenatal care itself. So why this antenatal care is essential? So as I already said, this pregnancy period is the time where there will be lot changes will be there. If it is not identified, the women can be even high risk too. So we need to maintain the health of the mother and we have to avoid the high risk pregnancies and we should be able to prevent them whatever it is possible at our side we should able to prevent or we can able to identify early and we can able to provide special attention to these kind of cases. And at the same time, during the primigravida status the women will be having lot of anxieties like emotional status will be disturbed. So we have to alleviate that anxiety discomforts and all through our advices and suggestions too. And these high risk pregnancies can lead to a mortality and morbidity, like maternal mortality rates and infant and neonatal mortality rates can be reduced by giving proper assessment and care during the antenatal period. And certain advices can be given regarding the nutrition, personal hygiene, as well as newborn care also. For facilitating all these things, antenatal care is very, very essential. And here we can see how many visits are required for an antenatal mother during the period of pregnancy. So these are the ideal visit, like usually till first 7 months of span, we do expect as like to come for the consultation like once in a month, like in the 8th month and all, like once for 2 weeks, the women can come for consultation, and in the 9th month and thereafter, like at least the consultation needs to be done for at least once in a week because this is the time at any time she can be into the labor. That's what close monitoring needs to be done. That's what the women needs to come for the consultation at least once a week itself. But in certain conditions and all, maybe because of there is no facilities of medical care or there is no transportation facilities, all the pregnant women cannot able to come as we said of ideal visits. So there are little minimal visits are there, the where the women needs to come for the visit. Like first visit at least by 20th week she has to get done, but ideally is before 12th week itself. 12th week itself the registration needs to be done before 12th week, and the second week visit at least before 32nd week, and the third visit can be before 36th week. So these are the minimum visits that the any women needs to have. Minimum of 3 visits are very, very mandatory for any antenatal women to avoid high risk conditions and to avoid lot many complications even. And next we shall see in the history what all data we need to be collected. Like history should start always with the baseline data or the identifying information, like what is the name of the woman, what is the age, and what is the time of pregnancy that she is in. Is it a first pregnancy or second pregnancy? So what is her socioeconomic status and from where she is belonging to, and what kind of when she has admitted into the hospital, what from where she is, from which kind of background, what is their monthly income. So all these also will give some or the other kind of basic information to identify whether the woman is having good nutritional status or not. All that kind of data it gives. So this information needs to be collected in the identifying information or can be called as like even baseline data also. And next we need to ask is regarding the chief complaints. So with what chief complaints the women has come to the hospital? Like some antenatal women, if we observe, like usually with the onset of labor pain, they'll be coming to the hospital. So that time we can consider that her chief complaint is a onset of contractions. That may be some women experiences in the lower abdomen, some women experiences even the back pain also, or else some pressurized symptoms the women will be experiencing, or during the antenatal period like UTI symptoms like burning micturition, or some may experience as like some headache, giddiness, which are the manifestations of hypertension. With whatever the manifestation, with whatever the complaints that the women has come to the hospital for consultation needs to be asked in the chief complaints. And one more thing that is very important in the antenatal period is to ask regarding the family history, because certain disorders will be there of medical as well as related to obstetric conditions also, which has this hereditary pattern, like especially like genetic origin will be there, some genetic disorders and diabetes, hypertension, all these will be having a hereditary impact. And multiple pregnancies, if we see from the obstetric conditions, spina bifida, sickle cell anemia, thalassemia, all these are of due to genetic origin. So these kind of disorders are running in the family or not, we need to collect the appropriate data. And also we have to collect regarding the menstrual history. So in relation to obstetric, menstrual history plays a very important role. In the menstrual history, we need to ask regarding at what age the menarche has taken place. Then we have to ask regarding the regularity of menstruation, the duration, and the flow of bleeding during the menstruation period, or is she having any abnormal dysfunctional uterine bleeding in the middle, either increased bleeding or decreased bleeding, or the cycle is maybe longer, or the cycle is like oligomenorrhea, hypermenorrhea, so this kind of, or hypomenorrhea, so this kind of menorrhagia, metrorrhagia, these kind of abnormal uterine bleedings are there for the women or not, we need to ask, which indicates that she's having some hormonal imbalances, her menstrual regularity is not present. And at the same time, premenstrual spotting, some of the women experiences like before the menstruation some kind of spotting. So does that kind of spotting this woman is having or not need to be asked. And next we need to ask regarding the obstetric history. This obstetric history includes is previous obstacle history, like past obstacle history, as well as present obstacle history also. The present obstacle history includes is especially we need to ask regarding LMP and EDD. So what is this LMP stands for is last menstrual period. So when the women had this last menstrual period and when is her expected date of delivery, we need to count by taking the consideration of last menstrual period. Like we are having Nichols formula is there, in consideration in weeks or 9 months plus 7 days, we will be calculating and we will be finding what is the expected date of delivery for the women. And at present, what is her gestational age? So we have to calculate in days, and if we subtract by in weeks, then we will know how many weeks she is in or how many months she is in. So present gestational age also we need to be identified. And what is the gravida of the women? So is she is of primary gravida or second gravida? So gravida means is nothing but the number of times that the woman is conceived. So irrespective of whether she has delivered or not, or whether she is aborted, or the baby is dead or IUD. So irrespective of what is the result, but if she has conceived means it is considered as like one gravida. If second time she is conceived means it is of second gravida. Third time, third gravida. So number of times that the woman is pregnant, so that gravida will be considered. So at the same time, we have to know even the para status also, like parity also it will be called. Gravida as well as parity. So what is this parity means is the number of times that the woman has delivered after reaching to the point of viability. So after the fetus reaches to the point of viability, so if the woman has delivered, it is considered as like parity. So what is this point of viability is usually we do consider as like 7th month of gestation. So if the conception or if the gestation has completed of 7th month, so it is indicating that the point of viability has been reached. So if the mother delivers baby after the 7th month, the baby can able to have its own independent survival with minimal interventions. That's what parity is after 7th month deliveries and all. And here is one more term which is considered as like grand multipara. So this grand multipara, if the woman has given birth for more than 5 times, it is considered as like grand multipara. So all this history need to be asked in the obstacle history. And coming to the present pregnancy, like as I already mentioned, LMP need to be find out. Like at the last, when she had the menstruation. And the EDD needs to be calculated by using the Niggles rule, Niggles formula, as I already mentioned. So this will be calculated in terms of weeks, in terms of months, as well as in terms of days also. Either 280 days we count, or else 40 weeks we count, or 9 months plus 7 days we count from the last menstrual period, so that we will be having the expected date of delivery also. And any events that the women had during the present pregnancy need to be asked. So if we check out during the period of gestation, like during the pregnancy period, in the first trimester, second trimester, as well as in the third trimester, certain changes will be present, which makes the women to have certain kind of manifestations also. Like if we observe in the first trimester, the women may be having like fainting will be there, or syncopal attacks will be there, or else the women will be having morning sickness or nauseated feeling, or the women will be having like a sensation for the odd smells and all. So like that kind of uh, certain events will be presented. Or else if we see like second gravida or third gravida, some women may experience like leukorrhea, or some women may experience like there is itching around the abdomen, which we call it as like pruritus, or else some leukorrhea, which is like or which is like genital discharges, like white non-irritant genital discharges, or some may experience as like pedal edema, or as the pregnancy advances, some women may experience as like shortness of breath as due to congestion. So because of whatever may be the reason, during the pregnancy, any events that the women has been experienced, all that needs to be asked during the pregnancy. Like especially cholesterol need to be can be asked, or lightening can be asked, or else quickening can be asked, or regarding immunization can be asked. So all these data can be collected during the pregnancy period. And next we shall see regarding in the physical examination what to be noted. So any physical examination will be starting with the anthropometry. So we are also in the antenatal assessment, we will be starting with the this anthropometry only. So why this anthropometry is essential for an antenatal? So even through this also we can able to identify whether the woman is high risk or not. Because height less than 150 centimeters is considered as high risk. She will not be for majority of the sake, she cannot able to undergo for the vaginal delivery because of the narrowed pubic arch. Or else wait, the BMI also is very essential. Obese or malnourished, very lean also is high risk only. And vital signs also is important, like temperature, pulse, respiration, blood pressure. So these all gives an information to us what is her health status, or is she hypertensive or hypotensive. So all this information is essential to identify. So is the woman is going to develop any complications, or is she at high risk? All this information will help us. And coming to general observation, what general observations need to be made? So what is appropriateness of appearance? So how is her appearance? Is she neat? Is she looking good? So how is her appearance? We need to identify. Because in some cases of like eclampsia, or in cases of any psychiatric complicating pregnancies, like blues, schizophrenias, like some psychological disorders also will be present. So most of the appearance will not be neat and tidy even. So how is her appearance? How is her stature? You can able to see. And apparent state of health. So when we look at a patient itself, we can able to identify, is she looking healthy or is she looking sick? So that also we can able to identify by single glance of the patient itself. And what is the mental and emotional status of the women? And some women, when she is talking about her pregnancy, or when she is taking counseling also, she starts to weep, and which shows that her emotional status is not good. Or sometimes unnecessary anger will be there, that means her emotions are not under her control. And what is her posture? How is her gait? Is the bodily movements are normal, or is the bodily movements are restricted? All that kind of data also we need to collect in the general observations itself. And next we shall see like systematic examination. So in the systematic, first we need to check out is integumentary system, because when we observe, the first what we focus upon is integumentary system, which includes regarding the skin. So mainly in the antenatal assessment in the skin, what findings will be present is other findings will be there as like any other medical condition. But specifically for antenatal, what will be present is pruritus will be present. That is pruritus, as I already said, that itching kind of sensation will be present, and pigmentation will be there. So this pigmentation mainly we see throughout the body, like in the form of chloasma gravidarum, like which we call it as like butterfly mask. We see in the on the cheeks of the women, forehead of the women, and some we see even upon to the nose also, and even their genital areas also become dark due to hormonal influences, and linea nigra will be there, stria gravidarum will be there, and a primary areola, secondary areola, Montgomery tubercles, all are the part of integumentary system changes itself. So this we need to check out. Is any rashes are present, or any extra moles are there? Is any unnecessary lesions are there? So is the women is experiencing any bodily itchings are there? And pigmentation, as I already said, the main important pigmentation we need to check out of the pregnancy change is chloasma gravidarum, which is also called as butterfly mask. And what is the moisture status? How is the skin turgor? So all these we need to assess in the integumentary system. And coming to the head to foot, which starts with hair and scalp, like any scalp infections are there, any dandruff is present, and lice are present. So all these will give one or the other kind of baseline data. And in the head, it is the women is experiencing headache. In some cases, like headache can be seen hypertension, preeclampsia, early stages of eclampsia, like severe headache will be present in the women. So we can able to assess through this headache also. And dizziness will be there as fainting, sinusitis, is this kind of symptoms are present or not can be identified. So as I already said, dizziness and fainting are usually seen in the first half of the pregnancy because of the hormonal influences. And coming to the eyes, in the eyes we can able to check out regarding the blurring of the vision, diplopia like double vision, photophobia. Some cannot have very sensitivity towards the light, so they may not able to see the light and all. Lacrimation like excessive lacrimation or decreased lacrimization, or redness of the eyes, or any conjunctiva. How is the conjunctiva? So conjunctiva identification is very important, which makes us to identify whether the woman is anemic or not, because during the pregnancy the majority of the women in the India are anemic. It is due to physiological anemia. So that can be a reason for increasing of mortality and morbidity even in the developing countries of like us. So that's what this conjunctiva and even mucous membranes and even lips to identify for the paleness is very important. And how is the reaction of the pupils towards the light? Are they reacting to the light? What is the size of the pupil? Also to be noted. And coming to the ears, in the ears also we need to check what is the hearing acuity of the women. Is she able to hear properly or not? Is there any earaches are there? Or is there a ringing kind of sensation, which we call it as like tinnitus, or vertigo is there? So is she not having any balance of such, or any infections, any tenderness, or any discharges are present from the ear? So is there any other kind of infections features are present? We need to be identified in the ears. And coming to the nose, main we have to check out is either any nose bleeding is present or any discharges are present from the nose. What is the patency of the nose? Is the nose is blocked? Because mucus congestion will be present in the antenatal women. So because of hormonal changes. So due to that, there can be even blockage of nose too. So all this epistaxis, discharges, subtle deviation need to be identified in the nose also. And next we shall see in the mouth and throat what need to be checked. So as I already said, the anemic status to be known through conjunctiva as well as from the condition of the lips also. And in the teeth, like in the lips, there will be like dryness will be there, angular stomatitis will be there, like crackedness will be there. That also can be checked out. And in the teeth, what is there any discoloration of the teeth for the women? Is there any dental caries are present? That also can be noted. And in the gums, any gum bleeding is there, because mucosa will be very sensitive for the antenatal women. And halitosis, that is foul smelling is present or not. In the tongue also can be checked, like glossitis is there. And in the oral mucosa, is there any oral stomatitis is present or not, or any bleeding is present, or any patches are there, any infections are there. All this need to be noted in the mouth and throat too. And coming to the findings from the neck, what is the movement? Is the range of movements are good or not? Is there any enlargement of lymph nodes or thyroid is present or not need to be identified? Because some women will be having hypothyroidism, hyperthyroidism, even this thyroid enlargement also will be present. And coming to the breast, breast flat or inverted, discharges are present, skin changes, all that needs to be noted. So we have in the next slide we will be seeing in depth regarding the breast examination. And in the gastrointestinal system, appetite, how is the appetite of the women? Like, is the woman is having a good appetite, or is she is having not having any appetite? So nausea, vomiting, as already we have mentioned, nausea, vomiting will be there for the women. In the gastrointestinal system, as like a minor discomfort, heartburn will be there. So all these what we are mentioning are like minor discomforts which occurs to the women due to hormonal influences itself. And any flatulence is there, so all that we need to check out, or any hemorrhoids are present. All these need to be identified. Any belchings are there, or any flatulence, or if the woman is suffering with any hemorrhoids or constipation, need to be checked out continuously. And coming to the cardiorespiratory system, we have to check out regarding the breathing pattern. Is the woman is having any cough sensations, wheezing, respiratory rhythm, rate? Is the respiratory rhythm and rates are regular or not? Or is the woman is having any tachycardia or tachypnea or bradycardia or bradypnea, or any wheezing kind or any grunting kind of sounds of abnormal sounds we have to identify, or any crepitus sounds. All these need to be checked out in the cardiorespiratory system. And coming to the genitourinary system, here we need to check out regarding the urinary difficulties. So is the woman is having urinary difficulties, or we can consider these are like part of UTI also. In the UTI, the women will be having like frequency as well as burning sensation. That kind of difficulties are there or not need to be identified. Any deviations from normal need to be identified in the genitourinary system. And coming to the muscular, skeletal, as well as vascular system, what is the status of the joints? So usually in case of some bacterial infections and all, there will be stiffness of the joints will be present. And sometimes muscles will be losing their own tonicity. And extremities, how they are. So is the range of motion in the extremities are good or not? All that can be monitored in the muscular, skeletal, as well as vascular system. And in the central nervous system includes is how is the speech and memory of the women, mental status, how it is she oriented to the present situation, is she mentally healthy or not, needs to be identified. And what is her motor symptoms? Like motor symptoms are nothing but their mobility and voluntary movements are present or not. So all that need to be checked out. And the sensory symptoms, is she is having a good sensory capabilities or not? And in the same way for lymphatic and hemopoietic system, how is the lymph nodes? Is the lymph nodes are enlarged or not? Is there any bruising tendencies are present? So in case of certain kinds of bleeding disorder, bruising will be present for the women. So all that need to be identified in the physical examination. So in the antenatal assessment, the main focus is to be given for the breast examination and abdominal examination. So as a part of all other things, as like general physical examination only, it will be performed. So in the breast examination, mainly here, what changes will be present? So in the image, you can able to observe that this is the normal and this is the changes that we can able to observe in the antenatal women. Like what changes are there? You can observe that here is primary areola is present around the nipple. That is one kind of integumentary change. And around to that, secondary areola is also present, which don't be seen in the non-pregnant women and all. And you can see that some modified sebaceous glands are present, which we call it as like Montgomery tubercles. And if you also see, like vascularity also has been increased. So here there is less vascularity, here there is more vascularity is present. And even there is enlargement of the breast also. And if you see the status of the nipples, usually in primary gravida and all, either flat or sometimes inverted, or even protruded nipples also will be present. So what is the status? Are they flat, or are they inverted, or are they protruded? So need to be checked out. And colostrum is getting expressed or not. So this colostrum is the milk that will be expressed from the 12th week of pregnancy itself. So this fluid which is secreted from the mammary gland of the women is called as colostrum. but actual lactation starts only after the birth of the baby, that is from the third or fourth day of the pregnancy, third or fourth day of postpartum. So this colostrum will be secreted from the antenatal period, that from the 12th week itself. So all these breast examination need to be identified. So main thing is primary areola, secondary areola, Montgomery tubercles, status of the nipples, and you can see the increased vascularity, enlargement will be there. So all these need to be identified. And next we shall see about the abdominal examination. So in the antenatal period, the abdominal examination plays a very crucial role. Here, the three methods of assessment will be followed, like inspection, palpation, and auscultation. So actually, we are having four methods of assessment, like inspection, palpation, percussion, and auscultation. Here, percussion will not be done upon to the pregnant uterus. So here in the inspection, what will be observed, what will be identified is inspection. We are seeing and we are identifying, like what is the size of the uterus. So size of the uterus is appropriate for the gestational age or not. So sometimes when we look at the abdomen of the women, she might be, when we calculated her gestational age, she might be of some 36 weeks. But when you look at her abdomen, her abdomen or her uterus is looking very small. So the size is not appropriate. Like in polyhydramnios or in case of multiple pregnancy, if you see, excuse me, in the polyhydramnios or in the multiple pregnancy, if we see, the abdomen will be larger than the period of gestation. So that also need to be noted. Is the uterus is larger than the period of gestation or smaller than the period of gestation or appropriate need to be checked out. And next we need to see is regarding the shape of the uterus. Is the shape of the uterus is globular or ovoid in shape? So during the early phases, usually globular shape it will be present. And in the early stages, we will see ovoid shape. So is that longitudinal ovoid or transverse ovoid? We need to check out. And the next is contour of the abdomen. So in the contour of the abdomen, we have to see what is the tonicity of the muscles. In the primigravida, we see the tonicity as like rigidity will be found. So the abdominal muscles will not be flabby. Whereas in case of multiparous, in primigravida, in case of cephalopelvic disproportion, we see even the flabbiness, pendulous abdomen in the primigravida status itself. So this contour needs to be noted. And the next is regarding the stria gravidarum. We will see upon to the abdomen of the women, like some stretch marks will be present. That stretch marks are nothing but stria gravidarum. And the last is regarding the linea nigra. So if you observe on this women's abdomen from the umbilicus, you see some dark colored line is present till the symphysis pubis. This dark pigmented line, which is extending from the umbilicus till symphysis pubis, it is called as linea nigra. So these changes or these findings need to be noted in the inspection. And along with that, previous surgical scars, like if the woman has underwent for cesarean section in the first pregnancy. So obviously previous surgical scar will be present. So what is the status of the umbilicus? Is the status of the umbilicus is flat or it is depressed? So flat umbilicus is representing that she is at the term. Depressed umbilicus is representing that she has not yet reached to term. And we can able to see the saucer shaped depression below the umbilicus in some women, but not all. So in case of mainly posterior positions, we can able to see like occipito-posterior position, we will see this saucer-shaped depression below the umbilicus and visible fetal movements. Like we will be experiencing sometimes when we start, like when we expose the women's abdomen itself, the baby starts to rotate and that movements we can able to see. So these all 9 findings need to be checked out in the abdominal examinations inspection. And next we shall see about the estimation of fundal height, which is also a part of palpation itself. So here in the estimation of fundal height, we have 3 methods at present. Like the first method is using finger breadth method. So finger breadth method, otherwise it can be considered as like investigating or identifying in terms of weeks. Fundal height in terms of weeks also we can say. So if we observe in the first image, like usually at diagnosis of pregnancy, at a particular week we are having like blind spots are there till where the gestational, till where the fundus will be present. So usually at 24 weeks, the umbilicus, the fundus will be, the top of the fundus will be at the umbilicus. So from there we will be marking till the upper border of the fundus, and from in between the umbilicus to that upper border, how many fingers we can able to accommodate, we will be checking. So how many fingers if we can able to accommodate, for example, above the umbilicus, 4 fingers if you are able to accommodate, it means the woman is having 28 weeks of gestation. That means the woman is having 28 weeks of fundal height. So here depends upon how many fingers we can able to accommodate above the umbilicus, we will be counting. And the second method includes is using of external pelvimeter. So you can observe in the second image that there is external pelvimeter is present. In the middle, there is scaling is present. So one point is placed at the symphysis pubis and the other point is placed at the upper border of the fundus. So in between, how much you can see that it is extension, the scale measurement we can able to observe. So here it will be in centimeters. So we can able to say that many centimeters are present. And the third method is by using of inch tape. So this is the regular method that we do. You can see in the third image, like we will be bordering or we will be marking the upper border of the fundus, and from the symphysis pubis to the upper border, we will be counting or we will be measuring with the use of inch tape. So these are the three methods we will be using for measuring the fundal height. So first one is by using of finger breadth, and second method is by using the external pelvimeter method, and the third method is by the use of inch tape. And next we shall see about the abdominal palpation. So when we start to perform this abdominal palpation, some of the preliminaries we have to follow. So we should see that the women's bladder is empty, because if the women's bladder is full, so we can't able to tell the correct findings and all, because we feel that the full bladder also has like hardness. It may confuse us with the fetal head. So that's what we have to see, that the women's bladder is emptied, and we have to see that the women's abdomen is completely exposed so that we can able to do the examination. And the women's abdomen muscles must be relaxed. So how we can able to ensure the relax is offer a pillow, or make the women to keep her both the hands on either sides and make her to have comfort so that her abdominal muscles are relaxed. If the abdominal muscles are tensed, what will happen is we can't able to make the findings properly. So we have to see that these preliminaries we are following. And always we have to see that when we are examining, we have to ensure that our hands are warm. So if we are keeping our cold chilled hands upon to the abdomen, obviously the abdominal muscles will be tensed and we can't able to make the findings properly. And before the palpating, we have to slightly rest our hands on the abdomen so that the women will be comfortable. And at the same time, always we have to use only the palmar part, but not the tips. So always we shouldn't palpate with the tips like this. We have to use the palmar portions only. So always we have to follow these kind of preliminaries. And here we have three types of palpation. The abdominal palpations are also called as Leopold Magnets. There are three palpations are there, like fundal palpation, lateral palpation, pelvic palpation. But four grips are present. Four grips, but three palpation. Fundal palpation, lateral palpation, pelvic palpation. In the fundal palpation, the midwife or the examiner who is doing this fundal palpation has to face towards the woman's head itself. And she has to curve her both the hands upon to the fundus, top of the fundus. You can see that in this particular image, the examiner is placing her hands at the top of the fundus. She is curving about to the top of the fundus. And she has to gently apply the pressure, and she has to find for these all the findings. So what findings need to be made is like shape first she has to find. What is the shape? Is the round shape is present or irregular shape is present? What is the size? Is the size is small or is the size is big? Or what is the consistency? Is the consistency is hard or is the consistency is soft? Is the mobility is present or not? Based on that, mainly we can able to say what is the presentation and what is the lie of the fetus also. So lie is of like we are having longitudinal lies and transverse lie also. Like if the head is present, like if hard mass is present, regular mass is there, and which is mobile, and the shape is globular, it is indicating that head is present at the fundus. Like the head is present at the fundus. And coming to the lateral palpation, in the lateral palpation, the women or the examiner has to face towards the women's head only continuously as like the fundal palpation. And she has to place her hands in between the umbilicus and the symphysis pubis. So in the first method, she has placed her hands above to the top of the fundus. In this particular method, she has to place her hands below to the in between the umbilicus and symphysis pubis. And we have to check out the firmly applying of pressure. So here, when we are applying the firm pressure, so we have to see either of one side we will be applying pressure, on the other side we will be making the rotatory movements. And in the second side also, we will be doing the same way. And we have to do the reversing of this particular procedure in the same way, like on the right side as well as on the left side also. So when we are doing this particular second palpation of lateral palpation, so what findings need to be made? So greater convexity is present or no irregular parts are present. So if greater convexity is present, it is indicating as it is of fetal back. And if the knobby regular parts are present, it is indicating that fetal extremities are present. So this is about the second palpation or the lateral palpation. And coming to the third, that is of polymania, which is called as second pelvic rib. So in this method, the women or the examiner has to face towards the women's head only. And here we have to ask the women to bend her knees, and the midwife or the examiner has to make a maneuver, and she has to hold the lower part at the symphysis pubis, above the symphysis pubis, in between the index, in between the thumb and the middle finger. So we have to hold the mass between the middle and thumb finger, and we should able to see what is the finding. So here also the same findings as like our fundal palpation itself. Like what is the shape? Is the shape is round or is the shape is irregular? Is the size is bigger or smaller? And what is the consistency? Is the consistency is hard or softer? Is mobility is present or not? So here we can able to identify what path is present towards the pelvis. Is the buttocks is present towards the pelvis, or is the head is present towards the pelvis? So this is the third mania, that is third Leopold mania, which is also considered as like second pelvic rib. And coming to the fourth Leopold's mania, which is considered as like first pelvic rib. For this, the midwife or the examiner has to face towards the women's feet, and still the women's knees must be bent only. And here we have to see that here what she has to do is in the same way how the fundal palpation is done by using of two hands, the same she has to perform at the symphysis pubis. And she has to do that deeply inward motions towards the pelvic inlet, and she can able to identify what findings are present at the symphysis pubis also. And mainly you can able to observe that how she has placed her hands of both above the symphysis pubis. So by this we can able to understand, again we can able to confirm what is a presentation. Is that the cephalic presentation or podalic presentation? Is that engagement has taken place or not? Or is the cephalic prominence is present or not? So when usually a good well-flexed attitude is present, you can feel on one side as like inciput, on the opposite side as like occiput. So usually this we do consider as like cephalic prominence. If this cephalic prominence is present, it indicates that a good flexed attitude is present. And at the same time, the examiner fingers are converged or diverged. Converged is nothing but coming towards each other, and divergent is going away from each other. So if already engagement has taken place, divergence will be present. If engagement is not taken place, like non-engaged theta, convergence will be presented. So these findings need to be made in the Leopold's manual. So on a whole, the Leopold manuals are of 4 grips, like but palpations is of 3 palpation: fundal palpation, lateral palpation, and pelvic palpation. But the abdominal examination will complete only with the auscultation. So inspection is over. palpation is over, and the last one is auscultation. So in the auscultation, by using of either fetoscope or ultrasonic fetal Doppler, the examiner will be identifying what is the fetal heart rate. So here, the fetal heart rate will help us to identify so whether the baby's health condition is normal or not. And at the same time, it can able to give information to us what is the presentation also. So you can see that depends upon the presentation and position of the fetus, even the location of the fetal heart rate also will be varying. Here in the occipito anterior, mento anterior, like in case of cephalic presentations, most of the fetal heart rate is below the umbilicus itself. And in case of occipito posterior position, you can see at the level of umbilicus. And in case of what is this, right sacroposterior, left right sacroanterior, which is a breech presentation, either above the level of umbilicus we will be finding. So depends upon the presentation and position of the fetus. Even this fetal heart rate where identification also will be varying. And next we shall see the laboratory investigations. So when the women is coming for the visit, certain investigations also will be performed, like urine analysis, like ketone bodies, albumin, sugar, which help us to identify, like usually ketone bodies will be present in case when the woman is dehydrated. Albumin will be present in the case when the woman is hypertensive. Sugar in case of gestational diabetes. And to rule out whether she's RH incompatibility is present or not. Blood grouping, RH factor needs to be identified. So to rule out that the woman is not physiologically anemic, hemoglobin and hematocrit needs to be identified. So complete blood count, and to rule out that there is no sexually transmitted diseases are present, like a VDRL, venereal disease research laboratory, like syphilis testing, HIV, tridot also need to be performed. And rubella immune status need to be identified. So if the immune status, if immunoglobulins are present related to this rubella virus, it may have serious impact as like teratogenicity will be present. So this is regarding the antenatal assessment. And now we will be discussing regarding the minor discomforts or minor disorders during the pregnancy. So because of the hormonal influences or accommodation changes, or maybe because of metabolic changes, so certain discomforts that the women will be experiencing, and these discomforts will be present in almost all the systems of the antenatal women. And coming to the first system, that is of digestive system. In the digestive system, first we can see about nausea and vomiting, which we can consider as like morning sickness also. So usually the onset will be between 4th to 16th week of gestation, and it will subside by itself by 12th or 16th week of gestation itself. And if we check out what is the reason for this nausea and vomiting is the hormonal influences. Mainly HCG, that is human chorionic gonadotropin, estrogen and progesterone are responsible for this nausea and vomiting. And how we can able to correct this? By increasing the carbohydrate intake for the women at the bedtime, or we can ask the women to have snacks, salads, because heavy meal also makes the women to get regurgitated and to have this nausea and vomiting. And also we can ask the women to have dry toast soon after waking up from the bed. So these kind of corrections can be made for the nausea and vomiting during the pregnancy. And coming to the second discomfort in the digestive system is heartburn. So this heartburn is nothing but a burning pain that the women experiences in the mediastinal region. It can be because of acid reflux, that the contents are getting regurgitated from the stomach to esophagus also. So why these contents are getting regurgitated is because of the relaxation of cardiac sphincter. The hormone, that is progesterone, makes all our smooth muscles to get relaxed, so that we may experience this kind of heartburn. So it may worsen as the pregnancy is advancing. So what correction or what management can be done is you can ask the women to opt a position where the regurgitation or the reflex will not be present, like avoiding of bending or kneeling positions, and asking the women to have small meals instead of a large meal, and which takes a longer time for digestion can be avoided, like fried foods or fatty foods, that kind of foods. And coming to the next, that is salivation, excessive salivation, which is also called as stylism. This will be occurring from the 8th week of gestation itself, but it is of minor and it doesn't require any kind of treatment also. And coming to the next one, that is of constipation. As already we have mentioned, because of the progesterone is having smooth muscle relaxation. It may influence the peristalsis of the gut, so which may leads to constipation. So what measures can be given to avoid the constipation can be advised to the women, like a diet, warm water, regular exercises can make the women to alleviate the symptoms of this constipation also. And next we shall see other symptom as like a backache, which is representing from the musculoskeletal system. The women will be having backache because the women will be changing of its center of gravity due to stretching of abdominal muscles. So what management or correction can be done is like postural re-education can be done, like what posture can be opted, what in which way she has to bend, in which way she has to sit, so that postural re-education can be done. And she has to opt a comfortable position, whatever she's in which position, like it may be standing or sitting or lying or even while lifting the object also, she has to always seek her comfortable position and do the activity. And next we shall see cramps. Like in some pregnant women, we can see this kind of cramps which usually wears at the night. So the reason can be the deficiency of vitamin B1. So most of the reasons are not known, but it is assumed as like deficiency of vitamin B1 or decreased levels of calcium also. So what management can be offered is like the supplementation. What is deficient can be supplemented to correct these manifestations of cramps. And while sleeping also, we can make the women to elevate her blood put level, so that she will have a good kind of circulation, like venous stasis won't be present. The reason for the cramps also can be venous stasis, that can be avoided. And warm bath also can be done, so to avoid this cramping kind of sensations. And coming to the next system, that is of genitourinary system. So the women will be having frequency of micturition. This frequency of micturition is because of compression of the urinary bladder by the gravid uterus. Here, as the fetus is growing, it will be compressing the urinary bladder, so that the women feels like she wanted to pass urination or she wanted to go for urination for multiple times. But this doesn't require any management or it doesn't require any care also. And coming to the next minor discomfort, that is leukorrhea. So this is the increased white non-irritant discharge will be present from the vagina. So if it is of non-irritant, it doesn't require any of medical consultation also. Like increased personal hygiene, like frequent washing of the vulva and with the plain water, and wearing of cotton innerwears or avoiding of tight garments can avoid the symptoms of this leukorrhea, or it will give comfort to the women, but it doesn't require any kind of management and all. And coming to the circulatory system, some of the women will be experiencing like fainting, like she will be fainting during the early stages of pregnancy. In the early stages means it is mainly because of vasodilatation, which is caused due to the hormonal influence of progesterone. So what correction can be done is we have to avoid the women, or we have to ask the women to avoid prolonged time single position, like it can be standing or it can be sitting or even lying down position also. And in the late pregnancy, if the woman is having this kind of fainting even during the supine position, it is due to the compression of the superior vena cava. So it is due to the compression of inferior vena cava, because the gravid uterus will be putting the pressure over to the inferior vena cava. So that is the reason why the woman is feeling fainting. So here what correction can be given is the women can avoid that kind of position. So when she is lying, she can opt side lying position instead of lying straight up onto the bed. So only at the time of examination, she can opt this kind of supine position. And coming to the other minor discomforts, that is varicosities. So as already we have mentioned, for everything, the reason is the same, hormones only. So here the reason for the varicosities also is progesterone, as it causes relaxation of smooth muscle and even makes the venous stasis also to get slowed. So there is slow circulation and venous stasis is present. That is a reason for these varicosities. And she can exercise for managing this kind of complaints, and wearing of supporting stockings, and making the legs to get elevated while sleeping, and all this can be avoided. So if the woman is having any hemorrhoid tendencies and all, she can avoid by taking high fiber intake, good fluid intake during the day. So these all can be avoided, or these all can be practiced to avoid the varicosities. And coming to the next one, that is of edema. So most of the women will be complaining that in the third trimester, they will be experiencing this kind of pitting edema, or what is this, a pedal edema they will be experiencing. So what correction can be done? Elevation of legs can be done, sleeping in the left lateral position, because whichever compresses the inferior vena cava, they have to avoid, and avoid sitting with the feet hanging down. So this kind of if they are avoiding, obviously they can able to avoid this edema also. And coming to the next one, that is of nervous system of carpal tunnel syndrome. So some of the pregnant women will be experiencing a kind of in the wrist region, a kind of pain or a tingling sensation, numbness, like something is pricking with the pins and needles, like that kind of sensation they'll be feeling. So what is the reason for this also is there is a fluid retention which is compressing the median nerve. That is the reason that why they are experiencing this kind of pain. So what the management can be done is they can use the splint at night, or they have to see that their hands are elevated so that there is no venous stasis is present. So the reason is venous stasis or fluid retention that has to be avoided. And coming to the next one, that is of insomnia. So as the pregnancy is gradually increasing, or as the fetal movements are increasing, frequency of micturition, or maybe due to increased fetal movements, the women cannot able to sleep properly in the night time. So what management has to be offered is like we have to ask the women at least to have some other alternatives. Like if she can't able to sleep at the night, at least she has to sleep or take good rest in the afternoon. And what can induce her sleep, like drinking warm milk, or lying in a comfortable position, or making her to alleviate her anxieties and all, may make her to have a good sleeping pattern. So these all are the minor discomforts that the women will be experiencing during the pregnancy and how to correct them. So I hope it's clear. To explore more this kind of content, download Prakara app and follow us on Instagram and YouTube. Thank you.